Welcome to Religion, where we highlight and teach you our best health practices for mind and body. Here are your hosts, Brent Anderson and Veronica Sosa.
Hello, my name is Brent Anderson.
And I'm Veronica Sosa.
And we are together on Religion, and we're going to talk about how anxiety affects movement and health and even people when we deal with pain. So as a physical therapist, we deal with this all the time, people who have these running thoughts or have the inability to overcome pain, and it gets in their way. And so I'm really excited to hear from Veronica as a psychologist of what her thoughts are on how this affects something that we typically would think of as a physical medicine or physical movement with people that are either rehabilitating or post-rehabilitating, getting back into functional activities, and how they can cope or get some coping skills to be more effective in that, and how real is anxiety for us?
Well, anxiety is a very real issue for a lot of people, and it's actually quite alarming to see how many people of all ages struggle with anxiety. And it can be around anything, really. When it comes specifically, when we're dealing with anxiety and how it gets in the way of our movement through daily life, or just going about the life that we want to have, or maybe going for a walk or working out or just doing things like that. I think one of the things that I really encourage people to do is to not stop moving. That is the most important thing. So even if they have become injured or something, obviously you let pain be your guide in the beginning, but don't just stop working out because you hurt yourself. Figure out what you can do, what still feels good.
And we spend a lot of time in physical therapy trying to get people to do that. Now, I was thinking, even backing up a step, Veronica, what is anxiety? I mean, people throw this word around all the time. I'm taking anti-anxiety medicine. My patients say it all the time, and I'm sure if there's times that I don't understand it, I'm sure that my clients and patients don't understand it either. Like, why are they getting anti-anxiety medicine? What is it what is it, anxiousness? Is it like these negative running thoughts? I mean, what is anxiety that keeps us from doing these things?
Exactly. So it's a lot of what you just described. It is nervousness. It is feelings of anxiousness. It can also be recurring negative thoughts or ideas or beliefs. It could be fears. But from a clinical standpoint, obviously, when those thoughts and ideas get in the way of the life that you want to have and are really impacting your ability to go about your life or to have healthy relationships, that's where it's a problem. And if it's stopping you from moving, that is also something that needs to be addressed very rapidly.
So in line with that, I mean, what I see sometimes too is that the anxiousness about, or anticipation even of, their anticipation that a movement is going to be painful. The anticipation created the pain, not the movement.
Well, and I think a lot of people over-identify with certain ideas or beliefs. So if they think they can't do something, or if they think that they're in pain, if they have a condition that they really believe prevents them from being great at something or being able to overcome something, then it almost becomes like a self-fulfilling prophecy. So I like to tell clients to work backwards. Figure out what it is that you want to do. So, for example, I was just on the phone with my parents the other day. My parents live in Argentina, and they're older adults, and they walk. In Argentina, they walk everywhere. And so my mother was telling me that she's been struggling to walk now because she has this pain in her hip. And she says, well, I'm not going to do that anymore. I'm not going to go meet the girls because it's too far of a walk. And the girls are these women that she hangs out with, and they're, all in their 70s and 80s. Yes. So she's not going to hang out with the girls because she's afraid to go on that 3 or 4 block walk. And so I said to her, I'm like, Mom, do this. If it's 3 or 4 blocks that you're normally walking, walk 2.5. Walk 2.5 blocks, and then have Dad either drop you off two blocks away from the house, but don't stop moving. Don't let that start to happen, it becomes a habit.
You bring a really important point, and that is that, if she stops participating, that often is what leads to the spiral or decline of health. When somebody makes that conscious decision of, I just, the pain doesn't let me do it, or my knees don't let me do it, or my back doesn't let me do it, or my fear doesn't let me do it.
And for older adults, it could be a fear of falling. And I see that quite a lot. I mean, there's a form of anxiety that's, or it's actually a phobia. It's called agoraphobia, where people stop leaving their home. And I have worked a lot with people who are very obese. And it's interesting to see when you have them kind of replay in their mind, at what point did they stop going out? Did they start withdrawing? Where they stopped going to the movie theaters? Where they stopped going on vacations because they were too embarrassed to maybe get on the plane because they were not sure that they were going to fit in the seat? So if most people go through the exercise of trying to identify that one point in time and what clicked in their brain that made them stop participating and stop doing those things that gave them joy and that let them go out with their friends or let them have a fun family vacation, what would it take to bring that back? And I think that's, if there's one bit of advice that I could give people, is try to identify those moments and try, when it's possible, to not stop moving. So if, again, using my mom's example, if it hurts after 4 blocks of walking, try walking 3.5 blocks. Make some modifications so you don't stop participating in the things that you want to do.
Part of my research was looking at that with chronic low back pain. And one of the things we discovered was that when people had positive movement experiences without pain, that it shifted their paradigm. So if they're walking around in their head the whole time that movement equals pain, and that anticipation, they're going to go out and move, and their movement's so guarded, so restricted that, it creates pain. And we had to figure out a way to successfully move them and get them moving and having experience that didn't have pain, so they could shift their paradigm back. So like what you're talking about is, maybe not the 3.5 blocks, maybe 2.5 blocks. You at least know that you're maintaining 2.5 blocks every day, that you're able to walk or participate in activities. Another question I have, Veronica, is when, we deal a lot with people that have chronic pain, and right now I think it's 1 out of 3 people, adults, is suffering from some form of chronic pain, whether it's chronic fatigue, or it's an autoimmune system problem, a rheumatology problem, or just back pain, fibromyalgia. I mean, these are all things that so many people deal with. I can just think of my own family of 5 or 6 people that are dealing with these kind of pain symptoms. And I also notice that they deal with anxiety. And I wonder sometimes, how much does the anxiety actually affect their perception of pain? I mean, because we know pain is a protective mechanism. So is it their anxiety or their fear that keeps this energy spiraling in a negative way, that we say we wire what we fire, and they just keep firing this thing in their head?
And it's one of those interesting situations or phenomena, I guess, where we really don't know what came first, the chicken or the egg. I mean, if you talk to people who have had chronic pain or people who've suffered from a debilitating condition, there is comorbidity with anxiety and depression. I mean, this condition really affects their quality of life. Time. And so it makes sense that they would have anxiety and depression. And usually anxiety and depression are very close cousins. And oftentimes some people tend to manifest more anxious symptoms and not necessarily the depression, but sometimes they're very interrelated. Right. Yeah. And so it's a good idea, and I believe that it's great to kind of work through that, to find out really what is at the root of it. And really it's about identifying coping strategies that will work for that person in the long run, right? Like, maybe this isn't going to be a chronic condition. What can you do today? What are those little things that you could do today to give yourself joy or to make yourself feel better? And
let's talk about that a little bit. In religion, one of our goals is to give you some tools, to give you some ways to deal with this. So if you're somebody that is dealing with this, either yourself or somebody you love, what are some basic tools? What are some things that we can do to minimize the effect of anxiety in our ability to move and participate in life and to be able to return to our activities without going down that slippery path that so many people do, like you mentioned your mother, that just stop participating. They become secluded in their home, and that's the worst thing that you can do regarding longevity.
Right.
Longevity is going to go right out the window if you stop participating.
So I'm going to share with you guys a little acronym that I use in my interview process with people, and hopefully if you remember this acronym, it's actually a Zen concept that I learned years and years ago, but so it spells out RAIN, so R-A-I-N, right? So
R-A-I-N.
R-A-I-N. Okay, so R stands for reality. So what is the reality of the situation? What are we really dealing with? Are we dealing with a diagnosis? Are we, whatever it is, let's put all the cards out on the table.
Now, does education help them with that part of it?
Nope.
No.
What is their version of reality? So what do they know for sure at this very moment? Does her hip hurt? Does she get migraines? Is this person dealing with they found out that their husband is cheating on them. I mean, this applies to whatever they know for sure. Okay?
So the reality.
The reality. And it may not necessarily, this is where I get really tough with my clients, because a lot of times they don't really want to see what's truly happening. They will tell me stories about what the doctor told them and what their neighbor thinks and what their mom thinks they should be doing, and it's this very complex, convoluted thing.
Yeah.
But the reality is this: they are not walking, or they can walk, but they are not walking, right? So we put all of those cards out on the table. Then the A is acceptance. And acceptance is a tricky one, because people think that means, oh, I just need to lay down and pretend, like roll over, and there's no solution to this, right? And acceptance is not really about that. It's not about giving up. It's just about being able to have that awareness. So I call the acceptance also awareness acceptance, right? So you're really dealing with, you're just looking at the problem, you have seen it for what it truly is, and you accept that is the reality of the situation.
Right.
Okay? The next step is actually my favorite step. And this is the part that I think this is one of my personal strengths. I'm very good at investigating and intervening.
So that's where the education
That's the
comes in.
I.
Yeah.
That's the I, right? So investigation and intervention. Let's educate ourselves on this. What does that diagnosis mean? What is it that you want to do? What other solutions have you thought of? What works? What definitely won't work, right? And this is where oftentimes you need to consult with an expert. Honestly, if you have a great coach and you have a good therapist or a great coach that is teaching you how to think through these things, because a lot of people actually get very stuck in this phase.
Absolutely.
And they really can't, they might educate themselves a little bit, but they really don't know necessarily how to make an adequate intervention. And then the last part is probably the most difficult part, and a part that I struggle with, I have to say, is non-personalization. So we don't identify with our problem. So yes, my knee hurts. And the last 9 times I went for a run, my knee hurt. But I will not say I have bad knees.
Yeah.
Okay, I will not accept that part.
So it's like the idea of internal and external locus of controlling.
Exactly.
It's like the knee's not controlling me.
Exactly.
I'm not defined by my knee.
Or other negative messages that might come with that, right? So it's, I'm not going to run anymore, or I suck at running, or whatever it is.
You reminded me.
Whatever these negative thoughts are that we, everybody has this little internal voice that like speaks to us, right? And so you cannot identify with those negative ideas.
You reminded me of a story. Years ago, I had a patient that came in with like mechanical low back pain, something that I would say, 2 weeks, you're going to be all better. 2 visits, you're going to be 80% better. We're going to get you back to everything normal. And I really believed it. And this patient came in. That's exactly what I told her. And 2 weeks had gone by, and she came back in. She's like, my back is still killing me. And we both were sort of scratching our head a little bit. She turned around and she said, Dios me está castigando. So God's punishing me. And I was like, come on back. And this is what you're talking about in that first, the R. And I was like, why would you say God's punishing you? And her answer was that she was having an affair with somebody that was an assistant of her husband's business, right? The superintendent. And it dawned on me very quickly that, she, in her belief model, right? So she was Católica, Apostólica, Romana, Cubana, so very staunch Catholic. And, she, in her belief model, which I had to also accept in that moment, even though my beliefs as a practitioner might have been different, that, she was in this scenario where she was having this back pain, but subconsciously or consciously, she was believing that it was because she was being punished for this sin that she's committing, right? So I'm always amazed at this interlacing, so complicated in us as human beings. But it came to me, and I said to her, you have three options. One, you can do what your belief model would be, which is you'd go talk to a priest or go through a repentance process, whatever you do, and stop this relationship. Two, you could change and believe in free love, free sex, free everything is all good. And she looked at me and I had that face like, not going to happen. And third, I said, you continue to have low back pain. And it was in that moment she said, my back doesn't hurt anymore. And I think it was along the lines of what you said, where she just had that sort of reality check of what was really causing. She heard it. She heard what she said. I didn't know.
So many times people will, and
I could have manipulated her back for 6 months and I never would have helped her out.
Well, and I see this in counseling all the time too. Like, people want to focus on the most external thing. So they'll come to counseling and they'll say, I need to fix my marriage, or I want you to work with my child because my child just got this diagnosis XYZ, right? And whenever I hear a parent say that to me, it's like every red flag goes up for me, because there is usually something else there. And I will always tell my clients, I do family systems work, which is also really integrative. And I will never take on a child client unless the parent is willing to work with me. And I will not even see the child until I've had maybe 2 or 3 sessions with a parent. And it's just amazing to me how many times people will want to focus on the back pain, or focus on, I have a client right now who I cannot get him past the fact he had knee replacement surgery, and he's gained weight, and he has sleep issues, and he also struggles with PTSD. This is a veteran. And I mean, there's just all of these layers, layer upon layer upon layer of challenges that he's facing. But he wants to talk to me every week. It's something so external, like things that he has no control over. And it's just really interesting, because when we start to peel back those layers, he's able to really start dealing with some of the true sources of pain and the things that are really keeping him up at night. And so,
and let's bring this to our reality here on this show. And the reality is all of us deal with these types of issues. All of us have these kind of things that we have to come to. I love the acronym of RAIN. I think that's going to help me a lot in my practice. But what I think is most important to our audience of religion is, how do you personally manage this? How do you know, it's perfectly okay for you to go get help? And, if you start asking your question on that first letter of the acronym is like, what is your reality? And you have some doubts, and you're thinking like, wow, do I really want to expose that? Is that really what's causing it? I mean, when you go talk to a counselor, it's completely confidential, and it's completely normal for us in today's day to have somebody that is counseling or coaching us. And, in our presence here with Veronica and I, our goal is to get people to take action. So we know that you could live like this one woman. I'm so glad we could help her in the sense of, I didn't treat her back. Her back was not the issue. It was an external manifestation.
But I was going to tell you something about that. I, as her therapist, would have actually treated her back, not manipulated her back necessarily, but I really would have looked at what is it about, if you think about what your spine is, right, that backbone, having pain in the thing that centers you, that gives you stability, that aligns you, where is that pain coming from? So
and we did treat that back.
Right. So I would almost
I
would go there with her, because I think that's really, really interesting.
And we've seen that so often, Veronica, where we've started with somebody, even on the Pilates equipment, doing, we had a lady where we were doing feet and strap with circles, and she broke down hysterically crying and got her to a room. And it was the first time that she'd ever told anybody as a 55-year-old that she had been sexually molested as a young 9, 10, 11-year-old by an uncle. And she'd never told a minister, she'd never told her parents, she'd never told a sibling. And here I was, the first person she told as a 55-year-old that had been married, 4 children, and never ever brought it out. And it was the movement of that part of the body. Imagine me being down below her legs, circling her legs and opening her legs, that there was something stored in the physical. And I think that also brings us back to why Veronica and I are here, is that we're looking at these systems that cross over all the time, and where we can introduce, physical therapy is a little more acceptable sometimes than psychotherapy, but they happen all the time.
And
together.
One of the things I will recommend oftentimes to parents is to help, and really anybody, if you wanted to make money or be great at business, would you go talk to your best friend about that? Like how to maximize or how to invest money? Would you go talk to your mom about that? No. You would go and you would speak to an expert in banking or consultant or an expert in the field, right? If I had extreme pain or something, I would want to know that I was going to speak with somebody who really understood anatomy and nerves and understand and really understood that. And the truth is that I think there is this negative stigma about
we want to get rid of that.
Right. How do you consult with an expert and have somebody that is going to be part of your tribe, like those people that you go to? It's part of your go-to, I call it like your dream team, right? Yeah. Like, who is part of your dream team, and how do you have someone in your family, maybe it's a member of your church or your therapist, a life coach or whatever, that that you can count on, that's going to steer you in the right direction. And it's really important to find those people. And if you can even teach your kids from a young age to have that person to know that you can go to a counselor if you're in college and you're struggling, right? Or parents aren't there all the time. So really kind of teaching those lessons early on, I think, is really important.
And that might have to be another topic that we share in the future in religion is, how to choose a provider. I mean, I think that's really important, whether it's a physical therapist, a doctor, a psychologist, a counselor, a family counselor, those kind of things. So thank you. That was some great information. Any last thing you'd want to share about maybe any other last tidbits or secrets about anxiety for our...
Well, we've talked about doing a whole segment just on anxiety, but more from a mental health perspective of what people can do to maybe even stop panic attacks, which is an extreme form of an anxiety attack. But we're going to talk more about that. But there's plenty of little exercises and things that people could do, and we'll take you through all of that.
So perfect. So stay tuned. And if you like this content and it resonates with you and you want to hang out with us more and learn more about how you can take action to be healthier and have that education, join us on the Religion podcast that we're working hard to give you unique techniques and hints and tips and some of our clinical secrets.
Yeah, strategies that work for you.
We'll see you in the future on our Religion.